Female infertility, a frequent condition, is the inability to conceive and carry a healthy pregnancy. After a woman has tried to become pregnant via unprotected intercourse for 12 months without success, she is often labeled with this condition. There are numerous ways to treat infertility, such as hormone-balancing drugs, physical problem-solving surgery, and in vitro fertilization or IVF. So let's examine the reasons behind female infertility, its signs and symptoms, and potential treatments. What is infertility among women? The disorder known as infertility affects or limits one's capacity to become pregnant as well as give birth to a child. After a year of attempting to get pregnant, this is typically diagnosed in heterosexual relationships, a man and a woman, but might be diagnosed sooner based on other factors. For heterosexual couples, 1/3 of infertility causes are attributable to male issues, 1/3 to female issues, and 1/3 to a combination of factors or unidentified causes. Female infertility, often known as female factor infertility, is the term used when the female partner is proven to be the cause of the infertility. Factors that pose a risk. You may be more susceptible to infertility as a result of several factors, such as age. With time, a woman's eggs lose both quality and number. The rate of follicular loss accelerates towards the middle of the 30s, producing fewer eggs of lower quality. This increases the chance of miscarriage and makes fertilization more challenging. Smoking. Smoking raises your risk of ectopic pregnancy and miscarriage, in addition to harming your fallopian tubes and cervix. Additionally, it's known to prematurely age the ovaries and diminish your egg supply. Prior to starting fertility therapy, stop smoking. Weight. Ovulation may be impacted by being significantly overweight or underweight. The risk of pregnancy and the frequency of ovulation may both rise with a normal body mass index or BMI. Sexual background. The fallopian tubes can suffer damage from STIs, such as chlamydia and gonorrhea. Unprotected sexual activity with numerous partners raises your risk for contracting an STD that could later affect your ability to conceive. Alcohol. Overindulgence in alcohol can lower fertility. What are the chances of infertility in women? The likelihood of female infertility varies significantly depending on the specific case and the underlying cause. The outlook is often optimistic when a structural anomaly, polyps or isolated fibroids, can be corrected surgically, or when a medicine may be used to address an ovulatory issue. To find out more about your prognosis, discuss with your doctor your family medical history, risk factors, and underlying medical conditions. The top causes of infertility. The majority of instances of infertility are caused by sporadic or non-existent ovulation. Ovulation difficulties can result from issues with the ovary, like the pituitary gland, or the brain, which regulates reproductive hormones. Ovarian polycystic syndrome, or PCOS. Ovulation is impacted by the hormonal imbalance brought on by PCOS. PCOS is linked to insulin resistance, obesity, abnormal body or facial hair development, and acne. It is the most frequent reason for infertility in women. Malfunction of a hypothalamus. Each month, the pituitary gland releases two chemicals, follicle-stimulating hormone, or FSH, as well as luteinizing hormone, to promote ovulation. A very high or extremely low body weight, a recent significant weight gain or loss, or excessive physical or emotional stress can all interfere with the production of all these hormones and impair ovulation. The most typical symptoms are irregular or missing menstruation. Primary insufficiency of the ovaries. This condition, also known as premature ovarian failure, is typically brought on by an immunological reaction or the early loss of eggs from your ovaries, which may be brought on by genetics or chemotherapy. In younger women, the ovary reduces estrogen production since it is no longer producing eggs. A surplus of prolactin. Prolactin can be produced in excess by the pituitary gland, which inhibits the production of estrogen and may result in infertility. The meds you're taking for a different ailment may possibly be the cause of this. Fallopian tube damage, or tubal infertility. Fallopian tubes that are damaged or clogged prevent sperm from reaching the egg or prevent the fertilized egg from entering the uterus. The following list of factors may contribute to fallopian tube injury or obstruction: chlamydia, gonorrhea, or other sexually transmitted infections that can cause the uterus and fallopian tubes, causing pelvic inflammatory disease. Previous pelvic or abdominal surgery may also be necessary for ectopic pregnancy, in which a fertilized egg implants and develops outside of the uterus, usually in a fallopian tube. Hormone imbalances. If your body isn't experiencing the typical hormonal changes that result in the release of a single egg from the ovary and the swelling of the uterine lining, you may not be conceiving. Obesity. According to a 2018 study, obesity may have a harmful impact on reproductive health. Compared to women without weight problems, obese women have a decreased chance of getting pregnant and are more likely to experience pregnancy-related problems. Endometriosis. When tissue that normally develops in the uterus implants and expands in other areas, endometriosis results. The surgical incision of this excess tissue growth may result in scarring, which may obstruct fallopian tubes and prevent the union of an egg and sperm. Additionally, endometriosis can prevent a fertilized egg from implanting properly. The illness also appears to harm sperm or eggs, which would have a less obvious impact on fertility. Cervical or uterine causes. The following uterine or cervical conditions may prevent the egg from implanting or raise the chance of miscarriage. The uterus frequently develops benign polyps or tumors, fibroids, or myomas. Some can reduce fertility by preventing implantation or blocking fallopian tubes. But plenty of women with fibroids or polyps do get pregnant. Unaccounted for infertility. Sometimes the reason for infertility is never identified. Unaccounted for reproductive issues may be brought on by a confluence of multiple small factors present in both partners. Even though it is upsetting to not receive a clear response, this issue will eventually go away. But you shouldn't put off getting infertility therapy. How is infertility in women treated? There are numerous treatment options available when your doctor has identified the cause of female infertility and made the diagnosis. The form of treatment depends on the underlying cause of infertility. For instance, surgery may be used to correct structural difficulties, while hormone medicines may be used to treat other disorders, ovulation problems, and thyroid conditions. Many patients will need in vitro fertilization or artificial insemination, which involves injecting cleaned sperm into the uterus after ovulation, fertilizing eggs with sperm in the laboratory to make embryos, then transferring that embryo into the uterus. Women experiencing infertility who want to have a family may also have options such as gestational surrogacy and adoption. Prevention. These advices might be helpful for ladies who are considering becoming pregnant naturally or in the future. Keep a healthy weight. Women who are overweight or underweight have a higher risk of developing ovulation problems. Exercise moderately if you need to lose weight. Exercise that is difficult and intense for more than 5 hours per week has been linked to a reduction in ovulation. Give up smoking. Tobacco use has a number of detrimental impacts on fertility as well as overall health and fetal health. If you do smoke and are thinking about getting pregnant, stop immediately. Skip the alcohol. Reduced fertility may result from heavy drinking, and any alcohol consumption can harm a fetus's health as it develops. Avoid alcohol and don't drink while pregnant if you intend to get pregnant. Be less stressed. According to certain research, couples who are stressed out may experience worse outcomes from infertility treatments. Prior to attempting for a baby, try to lessen your stress levels. It is greatly advised to seek medical attention and think about the preceding steps. Thank you so much for sticking around till the end of the video. We hope to see you in the next one. Like and subscribe for more videos similar to these.